Once the clamp has been placed, we have tested the stability of the clamp, we can go ahead and place the rubber dam. Before placing the rubber dam, it is preferable to check the contacts between the teeth where we're going to slide the rubber dam to make sure that there are no pieces of food or previous overhanging restorations stuck. You can go ahead and do that for all the teeth that we're going to slide the rubber dam in between them. Make sure they're clean, there's no calculus, no overhanging restoration, in order to make our rubber dam placement easier. Get the rubber dam sheet. We can go ahead and place a water-soluble lubricant onto the rubber dam sheet like that. We can brush it all around. This is done more in the lab because in the patient's mouth you wouldn't need that. There is the saliva. It will help to easily glide the rubber dam between the teeth. We go ahead, we get our jaw model, get our rubber dam. In your case, the jaw model will be stabilized inside the phantom's head, but for easier explanation and for a clearer view, I have taken it out and I'm going to explain on the jaw model outside of the phantom head. But inside the lab, we'll always place the rubber dam when the jaw model is inside the phantom head. So we go ahead, we start with the largest hole, and we try and slide it over the bow of the clamp retainer. Go ahead and slide, try to insert it, get it fitted. Once we have inserted the largest hole over the retainer, we go ahead and we secure our last hole, and that is going to be our canine. This way, it is easier for you not to miss any hole. You secure the last one, you slide it over, make sure it goes all the way inside, and then you can go ahead and go with the rest of the teeth. Once we have secured the last tooth, we need to stabilize it. We have 3 methods to stabilize the rubber dam, either by cutting a small piece of rubber dam, stabilizing the area distal to the last tooth, in order to keep the rubber dam stable in place while we move and where we do our procedure. You can go ahead and stretch the piece of rubber dam that you cut and place it inside. This is our first method of stabilizing the rubber dam distal to the last tooth. Another method is by using a small piece of dental floss. You can also floss it like that, and you can double it and place it here. And this way also, you'll guarantee that your rubber dam will be stable in place. Last method to do it is by using a wedge, a wooden wedge. You can also insert it from whichever area is easier for you. For me, I find it easier to insert it from the labial surface. Go ahead and pass it, and this way, your rubber dam will be stable in place. So the wedge will help to stabilize it. Just be careful not to tear the rubber dam in the process. Whatever way you find more comfortable for you, either a wedge, a piece of rubber dam can be used, or like I said before, a piece of dental floss. Anyway, you have to stabilize the last tooth and then go ahead and slide the other teeth in place inside their holes. As you can see, one by one, we try to insert them inside their holes. If the holes are punched properly, there will be no tearing, no stretching of the rubber dam. Each tooth will be easily slided in place, and then you can use the dental floss to make sure that the interproximal areas are all the way inside and the fit is nice and good, to prevent any seepage in the future. Go ahead and place them. And then we're going to use a dental floss to help us in the process. Okay. Once we have exposed the teeth, we can now get our piece of dental floss to start flossing the teeth one by one. We start from our molar tooth. Okay, now we'll start flossing. We press with both fingers to get the rubber dam. Inside, I don't like to take it upwards. I doubled it, I bend it, I doubled it. I leave part of it inside, and then I press again. This will help me push the rubber dam even further. Gingivally, you see I have a loop here, and then I push it towards the buccal. Let's try it again on the other tooth. I go ahead, I slide the rubber dam in place. First we have to make sure that the tooth is exposed. And then I loop it again. I push the rubber dam with it, and I go towards the buccal. This will prevent tearing of the rubber dam. Once again, mesial to the premolar, and then loop. Try to push the rubber dam, loop, leave the loop in the lingual, and pull towards the buccal. This is even easy in the patient's mouth, and it prevents hurting of the patient when you pull it upwards, and it prevents tearing of the rubber dam too. Go ahead, slide it over the canine, and then floss, make the loop, slide it further onto the canine, floss, pull towards the buccal. Go ahead again, slide it over the canine, mesial of the canine, floss, and pull it towards the buccal. Going to the incisors, make sure you push, you make the loop, and then you pull it. This is easier. The smaller teeth are always easier to insert. You can go ahead and try to push the rubber dam using the floss. The rubber dam is now in place, but we have these areas of the rubber dam, the cervical parts of the area, they're going upwards. This will cause saliva to seep out of these openings. What we want to do is try and push the rubber dam towards the sulcus inside. We can do that using a dental floss or a plastic instrument, and this is called inversion of the rubber dam. The rubber dam should be completely inverted